Hello, my name is Dr. Erwin Szela. I've been at Women's HealthFirst for my entire career. Looking back on my experience with minimally invasive surgery, throughout the many decades that I've practiced, there have been new inventions that have been applied to minimally invasive surgery. Robotic surgery came out, I believe, in 2006, but did not become commercially available until 2010. I became certified and trained in it in 2010 and found it to be superior for more complex cases. As far as the type of surgery that you can have with regards to treating gynecologic disorders, there's really, I view it as three basic types. There's open surgery, where you have an open incision, kind of like a C-section. The second type of surgery I would categorize as laparoscopic. In that type of surgery, you're using devices that kind of look like chopsticks, that are more very simple, kind of longer instruments that have rudimentary rotation and maybe grasping. And there's a limited number of energy sources that you can apply to the tips. The surgeon's standing on the side of the patient, using hand-eye coordination with their two hands, one holding a camera, one holding an instrument. So you're really trying to operate with one hand. That camera almost universally is unicular, and without binocular vision, you don't have depth perception, and that limits your ability to do more complex cases. The third area is robotic surgery. And in robotic surgery, it's preset where all your pedals are and where all the equipment is, and it's standardized in terms of the variableness of what kind of personnel you have, so it's a higher level of training crew that's working with you. The camera's binocular, and it's got 16K resolution, so it's phenomenal in terms of the depth perception that you can have and the clarity. You can zoom in and zoom out without using your hands, you have foot pedals. And the instruments are much more complex. They're about 8 millimeters at the tip. They have almost fully functioning wrists, and there's a whole kaleidoscope of different energy sources. And that's important because if you have energy sources that have very little collateral or peripheral damage, you can get really close to important structures without damaging them. And you have less tissue swelling, less blood loss, and that translates into a much faster recovery.